Most of the CBD you see in the vape stores and the gas station, you're gonna see this stuff everywhere. Most of that is isolate. So imagine one key on a piano being played all the time. Bing, 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 bing. It's annoying, right? But now you see the full spectrum of cannabinoids. Now envision a song or listen to a song with multiple keys playing. Your body's gonna embrace it. So that's really a dumbed down version of how to explain it that works really well. Sativa, stimulant, appetite suppressant, can be energizing. Don't take it before you go to bed. You'll stay up tossing and turn trying to solve all the world's problems. It's happened to me many times, and just don't do it. Indica, also known as in the couch. In the couch. Very sedative. You can take too much, but when you do, you pass out. So delivery methods. You got inhalation, you have sublingual, you have capsules, you have topical. Inhalation, fastest way to get the compounds into your bloodstream. Why? Because you got capillaries in your lungs, traps the vapor or smoke, delivers the compounds to your bloodstream almost instantly. Most patients report relief for 20 minutes to 2 hours, depending on your metabolism, depending on how you break it down. Fastest in and out, same as smoking a joint, by the way, ladies and gentlemen. By the way, flower should be available in the dispensaries in the next 60 days. Thank you, Governor DeSantis. Sublingual, very effective, as Dr. Hashem mentioned. That's what he recommends to start with. Everybody wants to smoke to try it, right? But some people it's unacceptable, right? So, and we respect that. Sublingual, oil under the tongue, hold it for at least a minute, and you get 20 to 40% of absorption rate through the mucous membranes underneath your tongue and in your mouth, and then you swallow. 4 to 6 hours of relief with an onset of 20 minutes to 40 minutes, depending on how you break down and metabolize. All right? So remember to sleep. Vape to go down, right? Sublingual to stay down, right? The vape's gonna put you down, but if you're having a high anxiety night, you're gonna wake back up in 2 hours, and what are you gonna do? Smoke a little more weed? I don't wanna do that. I wanna wake up and smoke weed. It sounds great, but I don't wanna do it. I'd rather take the sublingual, so I stay down. Patient success rate was very, very high using the sublingual to go down. Capsules. Anybody in here ever had a marijuana edible? Oh my God, we're got a bunch of stoners in here. All right. Well, marijuana edible is a very similar concept with a capsule, okay? You're ingesting, it's going down the tubes, you're metabolizing. It can take up to 2 hours for you to feel the effects, but the relief period can last 10 to 15 hours. That's a commitment. Biggest mistake people make is they take a capsule, they eat an edible, they don't feel shit, and what happens? They eat another one. And that, Dr. Hashem, is when you're found face down naked in front of the TV with Doritos everywhere. Guilty, all right? So topicals, very effective. Again, talk to Brad from Mary's Medicinals. He's a big topical guy. Topicals can be effective, sometimes not. You don't necessarily get high because THC doesn't necessarily break the blood-skin barrier, but Brad could definitely teach you a lot about that. That's your delivery methods, okay? Experiment with all of them. All right, experiment with all of them, keeping in mind that if you're just starting out, the capsules are probably not going to be the one to start with, unless you're in a lot of pain. If you're in a lot of physical pain, the capsules are very effective, but just don't plan on doing much. And that's if you're sensitive to THC. Some people don't feel capsules at all. And that's why this is a recommendation, not a prescription. That's why you get maximum dosing with all the delivery methods so that you can experiment, because we're all different. Does that make sense? So, capsules, very effective if you're in a lot of physical pain, especially if you're trying to get off the opiates and the benzos. Very, very effective because they last. It's a gift that keeps on giving.